Okay, I'm going to show you how to inject testosterone. Some of you are starting to use testosterone cypionate, and that's an injectable form of testosterone as opposed to testosterone cream. So there's some advantages to it. You only have to do it twice a week. There's no transfer between you and your partner or your children or grandkids or whomever. But let me show you how to do it, because a lot of people are not used to injecting themselves and there's a little bit of a sequence of getting it out of the vial and into you. So let me show you. So it all starts with a 1 cc syringe. And the first thing you do at the top where the syringe basically has the plunger, there'll be a tab here where there's sort of a natural separation in the two papers. And you just pull it down like that. And this will be a technique that you use for everything, where you peel things down and then hold everything else like that. So then what you want to do is leave the syringe like that for a second. You can set it down. And then, because the testosterone is viscous, it needs an 18 gauge needle to get it out of the vial. 18 gauge, kind of like shotguns. The lower the gauge, the bigger the bore. So a 12 gauge shotgun is a bigger bore than a 16 gauge shotgun. So an 18 gauge needle is going to be bigger around than a 25 gauge needle, which is what you want to put in you. You don't want to stick something big into yourself. So again, at the hub end of the needle, there's a little natural separation in the two elements of the paper and the cellophane folder there. And you just kind of peel it back like this. And again, you just then use that to essentially hold the needle. So then what I do is I'll take the syringe out and I'll attach the needle to the syringe just like that. And now I'll remove this. And then I don't have testosterone right here, but we're going to use a sort of a test tube, just to give you an idea how we would do this. So what we would do is I would set the needle down, take a alcohol prep, and you can either use an alcohol prep or you can have a bottle of alcohol with some cotton balls and then just dab the top like that. Then I set the alcohol prep back down, take the needle, now I pop this off. Got to be very careful not to stick yourself. Now the first thing I do is I pull back on the syringe. The syringe will be a little bit stuck at the base, and so you want to break that seal and just pull it back. A lot of you are going to be injecting between, that's 1, or that's 0.1, 0.2, 0.25, 0.3, 0.35. Most of you will be injecting somewhere between 0.25 and 0.35. So I tend to, let's pull it back to about 0.25 here. And I pull back that much air and then turn around and put it right into the center of the top like that. And then I'll inject that air into the bottle, and that way it equalizes pressure. Then when you want to pull it out, you basically pull it out like this, right? And you want to pull out a little extra than what you need and then push it back up to make sure there's no air in the syringe or in the needle. So I'm at about 0.25 right there, and now I'll flip it back up and then I pull this straight out. Now that's all I need for the testosterone. Now I need to switch needles, because I don't want to stick this big needle into me, right? So to recap a needle, never do it like this, never come at it like that. That's how you stab yourself. If you want to do it with the needle up, you come at it from the side, right, perpendicular, and just fold the needle into the cap like that. That way nobody gets stuck, right? So much needed instruction right here. Always, that's a sharp needle, always fold it into the cap so you don't get stuck, okay? Then you can basically leave that there for a second. Now we have our 25 gauge needle, which is much smaller in caliber. Same thing. At the end of the hub is fold in the paper, naturally split. I pop that open. I don't touch the needle. I just touch the paper. Very important. Only ever touch the paper. Now I'll take this needle off, right? Just by turning the syringe, it'll come out. And then I put the new needle on just like that, okay? So now I have that. And now what I'll do is I basically pop that off. Now this is actually a shorter needle than most of you will be using. This is like a 1/4 of an inch. You can have a needle usually that's a little longer. But you can see it's very small in caliber, right? It's not, really doesn't hurt. And then what you do, I'm not going to inject this unsterile water into my leg, but what you want to do is you want to stand up, and I'm wearing a pair of shorts for demonstration, and you basically swab a spot here, and then you'll take this and you'll basically pinch a little bit of skin and just slide the needle. I'm not going to inject it, but I will show you. You just kind of slide the needle at this angle, right, in just below the skin, and then run it underneath the skin. So it won't really hurt. You just put it in, and again, I don't have a sterile solution here, so I'm not going to put that in my body, but you just slide it in. It's just like that. I just pinch the skin a little bit, slide it in, and then slide it down. And then I'll hold it there and inject this, right? I'll put it into the alcohol pad, and then just pull it back out. And because you're standing, you have gravity taking the testosterone down. If there's a little bit of blood, you can have a little cotton ball or a little pad like that, sterile 2x2. Just hold pressure for a few minutes or a couple seconds even, and it'll go away. And then you're done. And you do that twice a week, and you can alternate legs. You can go high, you can go low. And then you want to recap this to throw it away. So again, never come like this. Always needles up, come at the side, perpendicular, fold it in, take the needle back off. Now this syringe can be thrown in the trash. Okay, there's nothing bad about throwing an empty syringe in the trash, but the needles need to be disposed of in a sharps container. So the two needles now, the 18 and the 25, both get disposed of in a sharps container, which here looks like that. Now you'll have a smaller one at home, but make sure that you dispose of the needles that way. The testosterone doesn't have to be refrigerated, so you can just keep it in your bathroom or wherever you're going to do this. So you'll just need syringes, the two needle sizes, the alcohol, the cotton ball, and the testosterone. So hopefully that's helpful to you. If you have any questions, just let us know. Thanks.